Hey there folks, welcome back to our channel. Today we are diving into the fascinating world of MRI, magnetic resonance imaging. Now don't let that name startle you. Trust me, I'm going to keep it very simple and fun. In earlier episodes, I had explained how X-ray machines and CT scans work. But both these techniques had an inherent problem. They both used X-rays, which is an ionizing radiation, which could cause health issues if used for a prolonged duration or many times. But science has found a better way to look into our bodies without using the dangerous X-rays. That is where the magic of MRI comes into the picture. MRI takes pictures of your insides without any side effects. And the technology which it uses is simply mind-blowing. And before I end, we will also see how the big brother of MRI, the fMRI or functional MRI works. Are you interested to learn how? Yes? So let's get started. Hello, I am Anand and you are welcome to the Miracles of Science series, where we decode complex technologies and make it easy enough for everyone to understand. The magnetic fields are starting to resonate. If we look into our body, you will find that water is present almost everywhere. Around 70% of our body is composed of water. And water constitutes of hydrogen and oxygen. 2 hydrogen atoms and 1 oxygen atom combine to form water. Now everyone knows that. Now the nucleus of the hydrogen atom or the proton inside it has a spin. And when any charged particle spins, it starts to act like a magnet. So the proton inside the hydrogen atom acts like a very tiny magnet. Or you can say it acts like a magnetic needle of a compass. Now when a magnetic needle is kept within an external magnetic field, it will align itself to its opposite poles. Like how the magnetic field of a compass aligns with the magnetic field of the earth. So when we place our bodies inside a strong magnetic field, the hydrogen atoms within the water inside our bodies tries to align itself with the external magnetic field. Now comes the interesting part. When an external magnetic field is applied to an atom, it shows something called the Zeeman Effect. In the absence of an external magnetic field, atoms and molecules have specific energy levels associated with their electrons and nuclei. When an external magnetic field is applied, the energy levels of the proton get split into 2 sublevels. For easier understanding, we can say it is found in 2 states. In one of these states, the proton spin is parallel to the magnetic field. In the other state, the proton spin is anti-parallel to the magnetic field. In the parallel alignment, the spin is in the same direction as the external magnetic field. This state is of lower energy. In the anti-parallel alignment, the nuclear magnetic moment is pointing in the opposite direction to the external magnetic field. This state is of higher energy. Let me explain it in a simple manner so that anyone can understand it. To do the same thing that everyone is doing does not require you to spend too much energy, but to go against the norm, to challenge the majority, that requires more energy, right? It requires more energy to be a rebel. It is the same at quantum levels too. To stay in the opposite direction requires more energy, and these nuclei are said to be in a higher energy state. Now, a radio signal or radio pulse is applied perpendicular to the magnetic field. The pulses are of a specific frequency which causes the hydrogen nuclei to absorb the energy. This absorption temporarily disrupts the alignment of the hydrogen nuclei. So, when the parallelly aligned hydrogen nuclei absorbs this energy, they also turn rebels and they get into an excited or higher energy state. This is called excitation. Now, the radio pulse is removed. Now, an atom cannot remain in an excited state for a long time. So, the hydrogen atom must return to their aligned state, a process which is called relaxation. During relaxation, the hydrogen nuclei release the absorbed energy in the form of radio frequency signals. These signals are detected by the MRI machine. The detected signals are processed by a computer to reconstruct detailed images of the internal structures of the body. Mathematical algorithms are employed to convert the signals into a 2 or three-dimensional image. And the computer will generate a brilliant image of the organ or area that we want to observe. Different tissues in the body have varying relaxation times, resulting in differences in signal intensity. That is, depending on the surrounding areas, different atoms return to the parallel states at different times. This variation provides a natural contrast in the images. And the best part is that depending on what we need to study, we can manipulate the images so that we can get a precise picture of the area that we need to see. Sometimes contrast agents such as gadolinium might be used to enhance the visibility of certain structures or abnormalities during an MRI scan. The only drawback this technique has is that we need to apply a very strong magnetic field to achieve these images. How strong? The strength of a magnetic field in an MRI machine is measured in Tesla. Most clinical MRI machines have field strengths ranging from 1.5 Tesla to 3 Tesla. How strong is it in comparison? Well, if you were to consider that the Earth's magnetic field has a strength of 0.00005 Tesla or 50 micro Tesla, you would know how much magnetic energy is applied inside an MRI machine. So, when someone like our king of pseudoscience or some fear-mongering or Vastu-promoting Instagrammers tell you that you are affected by the Earth's magnetic field and hence you should not sleep with your head facing north, please whisper MRI machine in their ears. If you believe that the Earth's magnetic field affects your iron in your blood or whatever, you should not go inside an MRI machine because the strength of the magnetic field inside an MRI machine is around 40,000 times bigger than what the Earth produces. If that doesn't do anything to your iron in your blood, the poor Earth is not going to affect your blood in any manner. But yeah, saying this will get you more views on YouTube and Instagram for sure. For more information on this incorrect notion that the Earth's magnetic field affects us, please watch this video where I have explained Earth's magnetism in detail. Now, you can't wear anything metallic when you are inside the MRI machine getting MRI'd. No watches and no jewelry. If you have any metallic implants like pacemakers, you need to inform the MRI staff beforehand. So, the magnetic field inside an MRI machine is not going to affect you in any manner. So why did I call this a drawback? Let me come to that now. The only problem is that it makes a great deal of noise while it works. The loud noises produced by an MRI machine are primarily due to the rapid switching on and off of magnetic fields during the imaging process. So one would need to wear ear protection or wear headphones and listen to music while getting yourself imaged. Also, the patient would have to lie still for a long time, which may be a discomfort for many. Also, claustrophobic patients may find the enclosed space of the MRI machine challenging. But these are minor things when you weigh it against the benefits. The MRI provides highly detailed images of soft tissues, organs, and the structures within the body. It is particularly effective in visualizing the brain, spinal cord, muscles, joints, and internal organs. Unlike X-rays and CT scans, MRI does not use ionizing radiation like X-rays. This makes it a safer option for repeated imaging studies and eliminates the associated risks of radiation exposure. Now before we end, let us look at one more imaging technique called functional MRI, which uses magnetic resonance. Functional magnetic resonance imaging, or fMRI, is like a special camera that takes pictures of your brain while you do different things. It helps scientists and doctors understand which parts of the brain are active when you perform certain tasks or think about something. Here is how it works. When a particular area of the brain is active, there is an increased demand for oxygen and glucose in that region. In response to this, there is an increased flow of blood to that area, leading to a temporary change in the concentration of oxygenated hemoglobin. Now, blood has a magnetic property, and both oxygenated and deoxygenated blood have different magnetic properties. The fMRI machine can detect changes in this magnetic property when there is more oxygenated blood in a particular part of your brain. While you are in an MRI machine, you might be asked to do different things like to solve puzzles or look at pictures. This activates different parts of your brain. The fMRI machine takes a lot of pictures of your brain over time, showing how blood flow changes when you're doing different tasks. Scientists use these pictures to create maps of your brain. They can see which parts are active during specific tasks. This helps scientists and doctors understand how your brain works, which is important for studying things like memory, language, or even brain disorders. And finally, there is another technique called resting state fMRI. This is like looking at your brain when you're not doing anything in particular. Imagine your brain as a car engine. Even when the car is standing still at a traffic light, the engine still has some activity, right? So instead of making you do specific tasks like solving puzzles, resting state fMRI just watches your brain while you're not actively thinking about something or doing any particular activity. So even when you're not doing anything, your brain is still active. The fMRI machine takes pictures of your brain to see which areas are talking to each other, sort of like checking which parts of the brain are connected or communicating. Scientists use this information to understand how different parts of your brain work together, forming networks. This method is particularly helpful for studying conditions where the brain networks may be affected, like in certain neurological or psychiatric disorders. We can now study the brain without affecting the brain. How cool is that? And before I end this video, I have a request for everyone who has watched it this far. I know my earlier videos on how X-rays and CT scans work did not get too many takers and the views were less. The reason why I keep doing these videos is because there are many people out there who have many misconceptions regarding this gee-whiz kind of technologies because they don't understand how they work. They think these machines are some kind of stuff from a sci-fi movie or machines that hospitals have bought so that they can fleece people of their money. If they understand how they work, then maybe, just maybe, it would help some people replace or reduce their fears about these technologies. So if you think this video would benefit someone else, please share it within your social media circles. I have one more technology left to cover in this series, which is the PET scan. If you want me to make a video on it soon, please comment and let me know. I will do it based on the number of responses that I get for this video. As usual, I hope you found this video interesting and the information useful and new. If you like hearing scientific and rational content, please do subscribe to the channel. I shall see you in another interesting video very soon. Until then, goodbye.